Guilford County Schools is building community partnerships, finding new ways to provide better student resources.
Hunter Funk learned that a new telehealth program is keeping kids from missing class.
Rather you have it and don't need it than you need it and you don't have it.
Danielle Mack is a third grade teacher at Peck, and her son also goes to school there. In February, telehealth was implemented there.
I didn't sign up at first, and I'm not going to say I didn't see the value because it's very valuable, but I'm here. So I said, I'll just give him medicine if he needs it. Of course, I forgot his medicine that day, and it was very convenient. About 15 minutes later, he was so much better and fine, and had I not had that service, it would have been a whole process of trying to get him some medicine.
Mac appreciates knowing there's someone there to step in.
Now you have that assurance that you can send them to the nurse. She can look them over quickly and assess what's going on and what further needs to happen.
We don't necessarily have to stop what we're doing as educators to attend to medical needs. There's somebody right here that can do that.
Peck Principal Ashley Triplett says it's a partnership with the district, Guilford Education Alliance, and Cone Health. The school is one of 14 schools with the services. 12 more schools will be added in the next year. Here's how it works. Cone Health certified medical assistants work during the entire school day. If a parent gives consent for the telehealth service, when a student has a medical issue, the CMA determines if the student needs a virtual doctor visit. If that's the case, the parent will be called along with a doctor.
Students are able to stay in school, parents are able to stay at work, and it's just been really positive for our school community.
Triplett says it helps with attendance too.
What you don't see are students that leave early in the afternoon, right after that half-day cutoff. I've certainly seen students staying in school.
In the district, about 40% of families gave consent to use the service. Now, getting consent and finding space are among the challenges GCS is working to overcome.
We can go to one school and they might have a space right there available close to the office or close to the area where the traffic comes, and it can be easy. But we go to other places and all they literally have is a 6x6 closet.
Right now, telehealth is being funded through the Education Alliance, private donors, and grant funding. It's the district's hope that state funding will eventually step in, so it's not just going to high poverty areas, but to all schools.
There's a critical role that we can play in that accessibility, especially for some of our families that really struggle with that option. So telehealth is a strong piece of that.
Great program in Winston-Salem for South County Schools. They have telehealth services in 7 schools. It's paid for through a grant, and while they want to keep the services, they will need to find other funding options.